Making it out of the intensive care unit, that's a huge victory. It's a real testament to modern medicine and just sheer human resilience. But what happens after the machines are switched off and the patient finally goes home? Well, it turns out surviving the ICU is often just the first battle in a much longer and much quieter war. And this quote, it just nails it. While doctors and nurses are busy fighting the storm of a critical illness, a shadow can be silently creeping over the patient. We're talking about a profound weakness that has nothing to do with why they were in the ICU in the first place. It's a powerful idea, and to really get what that means, we've got to look at what's happening both inside the ICU and then what happens long after. Okay, so first things first. To really get a handle on the challenges that pop up after the ICU, you have to appreciate just how intense the fight inside it really is. This is a world of high-stakes, split-second medical intervention. So, right at the heart of all this critical care is something called hemodynamic monitoring. Yeah, it sounds super technical, but the goal is actually pretty straightforward. Get a constant, super precise look at how a patient's heart and blood vessels are doing their job. This constant flood of data is what separates guessing from knowing. It lets doctors make those life or death decisions about fluids, medications, and all the other critical support they need. So, what exactly are they tracking with all this tech? Well, it's the most fundamental rhythm of life, right? The cardiac cycle. It's this beautiful, powerful two-step dance. In diastole, the heart relaxes and fills up with blood. Then, in systole, it contracts and pumps all that blood out to the rest of the body. Every single beat tells a story, and in the ICU, that story is absolutely crucial for survival. But here's the catch. While all this incredible technology is zeroed in on keeping that heart pumping and making sure the organs get blood, something else can be happening, something almost totally unseen. That shadow we talked about, it starts to grow. And it has a name. It's called ICU-acquired weakness, or ICU-AW for short. Now, this is not just feeling a little tired after being sick. We're talking about a severe weakness that happens because of the critical illness and everything it takes to treat it. All those necessary life-saving measures, like being on a ventilator or being unable to move, can take a silent toll on the body. And here's the part that's, well, it's genuinely shocking. Just how common is this? Take a look. Yeah, you're seeing that right. Anywhere from a quarter to over 2/3 of all ICU patients. Think about that for a second. For so many people, this isn't a rare complication. It's almost an expected part of the journey. And let's be super clear here. This isn't just some minor side effect. This weakness makes it way harder for patients to start breathing on their own again, which keeps them on ventilators longer. It means they're stuck in the hospital longer, and it casts this long, dark shadow over their ability to recover and just get back to their lives once they're finally home. And that's where the story gets even more complicated. Because that ICU-required weakness, it's often just one piece of a much, much bigger puzzle that survivors and their families are left trying to put together. And that puzzle, it has a name: post-intensive care syndrome. We call it PICS. This thing affects up to half of all ICU survivors. And it's basically an umbrella term for all the physical, cognitive, and psychological fallout that can stick around for months, or in some cases, even years. The easiest way to think about PICS is to break it down into three main pillars. You've got the physical impairments, which includes that ICU-acquired weakness we were just talking about. Then you've got the cognitive impairments, so problems with memory, attention, that kind of thing. And finally, you have the psychiatric symptoms. Okay, let's just zoom in on that cognitive part for a second, because this is staggering. A major study found that an entire year after leaving the ICU, more than 1/3 of survivors had cognitive test scores that were on par with someone who'd had a moderate traumatic brain injury. I mean, we're not just talking about brain fog here. This is a profound, life-altering level of impairment. And the emotional and mental toll, it's just as heavy. I mean, just look at these numbers. Nearly half of survivors struggle with anxiety, 40% with depression. Over 1/5 develop PTSD from what they went through. And on top of all that, a huge majority, up to 77%, are living with chronic pain. It's a whole collection of invisible wounds that can be just as crippling as the illness that put them in the hospital. So, okay, let's recap. We have patients leaving the hospital with this whole constellation of really tough problems. They've won the war for their life, but now they're facing a brand new battle at home. And this is the moment, this critical handoff, where the system itself so often drops the ball. So when you leave the hospital, there's this document, the discharge summary. It's supposed to be the bridge connecting the hospital doctors to your family doctor. But when that summary is late, or it's missing key info, or it's just plain unclear, that bridge just collapses. And this isn't a paperwork problem, it's a patient safety crisis. It can lead to serious mistakes and land people right back in the hospital.
But here's the thing, and this is the hopeful part. This is a totally fixable problem. So check out the study from a pediatric ICU. Before they did anything, look at that. Fewer than 40% of discharge summaries were done on time. But after implementing a few simple changes, wow, that number shot up to almost 90%.
So what was this revolutionary, game-changing intervention? It was shockingly simple. They made a standard template, they trained the doctors how to use it, and they set a clear policy with a deadline. That's it. No fancy new machine, no billion-dollar drug, just better communication and a better process. It's a fantastic reminder that sometimes the biggest improvements come from the simplest changes.
Okay, so this really brings us to the big picture, right? We've seen the fight inside the ICU, we've seen the hidden challenges that pop up there, and the cracks in the system that fail patients on their way out. The question is, how do we build a better road home for these survivors?
It all starts with a huge shift in how we think about this. The goal of critical care can't just be about getting a patient out of the ICU alive anymore. The real goal has to be about the quality of that survival. And getting to that quality of survival, well, that takes a completely new playbook. It means thinking about recovery from day one. It means getting patients moving early with physical therapy, even when they're still in the ICU bed. It means optimizing their nutrition. It means building teams of different specialists who all work together. It means fixing that broken handoff with clear, standardized communication. And, this is huge, creating special post-ICU clinics to help guide survivors through that long, complicated recovery.
Look, celebrating that someone survived the ICU is absolutely essential. It's the victory that makes everything else possible. But as we've seen today, the battle doesn't end when they walk out the hospital doors. So the real question we have to ask ourselves is, are we, as a healthcare system, as a society, really doing enough to help these survivors win the long, hard-fought peace that comes after?